Hi, I'm Dr. Dallas Hancock. I'm a licensed massage therapist and chiropractor. I have a PhD in neuromusculoskeletal compensation, and I've been in practice for about 35 years. I've also been teaching cranial techniques since 1990. I currently teach internationally with my wife into the Hancock Craniosomatic Institute. What I'd like to share with you here today is that the body consists of multiple patterns of neuromuscular compensation that appear to be compensatory to chronic cranial patterns. So I don't find that I can remove these patterns with any techniques other than cranial techniques. So what I would like to do today is demonstrate to you these common patterns, and then I will release one of these patterns, a torsion pattern, and show you the changes that it makes. These changes are generally long lasting. When I bring people back in or see them for visit after visit, these patterns are still holding. And whereas before I couldn't get the patient off the table without these patterns coming back, now they can hop around the room, they can jog around the block. It really doesn't matter. Once you free the cranium up here, most of these patterns will disappear. So let me demonstrate these. First of all, let me thank the Oakworks company for allowing me to demonstrate these techniques and to use their Prolux convertible table. It's really a great table for people, cranial practitioners like myself, who have been trying to get feet under tables for years and are confronted by braces. There are no braces here. Not only that, it adjusts to our height, and it is really a great table. So for cranial practitioners, it comes highly recommended. So my model for today is Jerry. So what I will do, I'm only going to evaluate prone and supine positions. I'm going to use manual muscle testing, therapy localization, challenge, active and passive reflexes, ranges of motion, and palpation. So with these, I will demonstrate the patterns that are there, and then with her permission, I will make a correction to a torsion pattern and show you all the things that change from that. So what we will observe first off with Jerry here is that we have a functional short right leg. And if we look at the gastroc region on the left is sort of flattened and rounded. On the right, it's sort of peaked on the outer lateral side. So if we go back and we check the tension in the gastrocs, we have plenty of movement in the left gastroc. And on the right side, no matter how hard I pull, I can't get any movement in the gastrocs. Also, when I go up to the glutes here, and I palpate the glutes, on the left side, I'm only sinking in maybe 1/8 of an inch to 1/4 of an inch. The same amount of pressure on the right side, I'm sinking in about 1/2 inch. So the right glute is much more flaccid than the left. We're going to see this in terms of muscle testing in a second. So with that, I want to check the glutes. So I need to bend the leg 90 degrees to take the hamstrings as much out of the test as I can. So bring the leg up in the air, hold it up, and resist when I push down. What I'm looking for here is not just how strong she is, I'm looking for whether or not the muscle catches, whether it grabs. So the left side is strong. When I come over to the right side, bend leg again, raise leg up in the air, hold when I push down, hold, you will see she just collapses. Now, let me check one other thing here. Let me borrow the arm over here, the right arm. If I check the extensors in the shoulder here, hold, we will find that the shoulder extensors don't work on the right side, are inhibited, and over here the shoulder muscles on the left side are strong. So, okay, let me have you turn over on your back. So to sum that up, on the left side, the extensors are strong, and on the right side, they're restricted, inhibited. When I come back over and we're in a supine position, I'm going to check the shoulder and hip flexors here. So hold the arm up. The arm is catching, it is strong, it's locking in place, and there's no point in seeing how much strength she's got. Hold. If I check it and it locks, then the muscle is doing well. If I check the leg here, hold this up, that locks in place. Now, if I try the comparable muscles on the other side, hold this, hold. So what we're seeing is it can't lock in place, it can't catch, it just slides down. And the same thing is we're going to see the same thing here on the shoulder flexor. Hold, it just doesn't catch, it just goes down. Now, so we have functional hip and shoulder flexors on the right side. Remember, they were weak when we were in the prone position. And on the left side, we now have inhibited shoulder and hip flexors. But this pattern, which is basically a torsion pattern, cranial torsion pattern, affects eye muscles, it affects jaw, and so and so. If we take any strong muscle group, hold, and we have the person do something, turn eyes, open mouth, and so, and it inhibits this arm, then we can see that there's some action occurring. And what we're going to see later, when I change the torsion pattern, this won't occur anymore. So right now, check arm, it is strong, open your mouth wide. When she does that, the arm gives out. Now, shift jaw to the left, hold. You can note that she can shift jaw to the left, shift jaw to the right. She can't shift it to the right. Jut your jaw forward, hold. She can hold that, retract it. She can't retract her jaw. Look to the left. She's strong. Look to the right. Inhibit it again. Now, if I cover up one eye, we're going to find that she's going to be weak regardless of whether she goes left, right, superior, or inferior, or even straight ahead. So look to the left. Arm weak. Look to the right. Nothing. Top of your head. Toward your feet. Straight ahead. Look to the left. To the right. Top of your head. Toward your feet. Straight ahead. Now, if I took SOT blocks and I put a high one under the right iliac crest here and a low one under the ischial tuberosity and changed the pelvis, in other words, what we would consider in SOT a right category 2, then these patterns will all immediately change. However, as soon as she stands up, the patterns will return. And so she can't walk around my table without them coming back. So putting the blocks underneath here, it seems to make enough cranial correction to change the eye patterns, the jaw patterns, and the muscle patterns, but it isn't changing the cranium enough that the cranium can hold the pattern. So at this stage, I would like to demonstrate a right torsion correction and what effect it's going to have on the body.